We have more evidence tonight that the cost of Obamacare is going up, way up. Chief Legal Correspondent Shannon Bream is here with a look at the numbers. Good evening, Shannon.
Hi, Brett. Well, despite assurances that the Affordable Care Act, or Obamacare, would make health care more accessible, both deductibles and premiums continue to rise, while access to doctors and care continues to narrow. Marilyn Tavner, who once served as the administrator of the Centers for Medicaid and Medicare Services, or CMS, and also oversaw the glitch-ridden rollout of ObamaCare.com, is now the president and CEO of America's health insurance plans, and predicts that premiums are set to trend even higher than we've seen in previous years. That follows dramatic jumps in deductibles, some states reporting spikes as high as 76% this year.
The companies that are putting the plans together have learned that the only way you can comply with all of the many requirements and regulations and mandates that are built into Obamacare and still have a product that isn't outrageously expensive in terms of premiums is to have much higher deductibles.
Analysts say insurance companies are having a tough time complying with the law and remaining financially viable. Sicker people are signing up now that they have better access, while many healthier Americans are choosing to risk the tax penalty instead. The law puts a cap on insurers' profits, and soon most of the so-called bailout or risk mitigation programs designed to protect insurers will expire. Just last week, UnitedHealthcare announced it intends to exit most Obamacare markets. The administration says reports of increased costs are being blown out of proportion, that once tax credits are factored in, the increases will have less of a real-world impact. As for the skyrocketing premiums, Dr. Mandy Cohen, who is COO of CMS, says, quote, "Opening rates that folks file are certainly not the impact that consumers will feel, and you should take those with a big grain of salt." According to polling by NPR and the Robert Wood Johnson Foundation, just 15% of Americans say they've benefited from the health care law, while 26% report they've actually been harmed by it. Brett?
Shannon, thank you. A group of middle